Good evening all, and welcome. I hope you're ready to get your gloves and mask on, as tonight's video is going to be especially gruesome. I warn you, some of these stories are very, very disturbing. So, if you've got a faint heart and do not wish to proceed, you've been warned. But anyway, for now guys, it's time to get comfortable and let the darkness take control. I had a patient who was older than dirt, riddled with cancer, and was in the hospital for a DVT. He died between rounds, but we had to code him anyway. As I was pumping on his chest, while everyone else was moving his roommate out and bringing the crash cart, he started vomiting this disgusting, thick, brown, red crap. Every time I thrust, more would come out. I am trying to do effective compressions while holding his head to the side to prevent, or rather at least reduce, aspiration. We coded for more than an hour, and he never stopped being dead. And then I had to stay like an extra 2 hours to finish the work I didn't get done. Oh, and there was also the incident of the dude who had his toe amputated, and then we saw him back a month later. He hadn't changed the bandages at all, and his wound had got maggots in it. Apparently, his daughter came to his house to take him out for Father's Day. She helped him dress, saw the maggots, went out to eat anyway, then brought him to the ER. The ER opened the bandage and went, "Hey look, maggots," and replaced it, then sent him to the floor. Day shift nurses looked and went, "Oh my god, maggots," and left it for us. I had to take photos for wound care documentation, and then we drowned the maggots and finally put a clean bandage on. He ended up having to get an above-the-knee amputation, but at least the maggots reduced the infection enough to save his life. This happened to my wife. She is an RN, and she was on float to another unit helping out, as she normally worked cardiac, but she was helping out on this one occasion in the Alzheimer's unit. She was saving a particular patient for last, as the patient was very well known to be a real pain. Very old and mean to everyone, and just generally tried to make the nurses miserable. She and the respiratory therapist got to the patient's room at the time, so they decided to tackle her together. They got to the room, and the patient had smeared shit all over the walls of the bathroom and the hospital room. She was standing on the bed, screaming and jumping up and down. The two of them somehow got the patient calm, got the horrible mess cleaned up, and got their job done. She said it took about 3 hours. They then went and put a big "Do Not Disturb" sign on the door to make sure the patient could calm down and get some sleep. They were standing, one person on each side of the door, herself and the respiratory therapist, catching their breath and proclaiming how much that sucked, when they spotted someone. A big farmer-looking guy wearing a John Deere baseball cap, overalls, a red plaid checkered shirt, and big work boots, coming down the hospital hallway, and he looked kind of annoyed. He walked right past them into the patient's room, slamming the door open. My wife caught the door on the backswing and marched right into the room after him, with the respiratory therapist right behind her, planning on dragging him back out and giving him a piece of her mind. When she got in, he was not in the room. There was no sign of the person she followed in. She looked under the bed, she looked in the bathroom, and she checked behind all the curtains. She even made sure The window still would not be open. No sign of the farmer at all. She then noticed the patient was sitting upright in bed, just kind of staring off into space. So she asked her, "Did you see someone come into the room?" The patient replied, "Yes, it was my daddy. He said he was coming to take me home tonight, and that you mean people won't be able to hurt me anymore." She responded with, "That's great. How about you get some rest before he comes to collect you?" The patient then lay down and went to sleep. The patient died that night. My wife and the respiratory therapist swapped stories to make sure they were not crazy. They both saw it. My mother works in a hospital, so I've heard enough horror stories. One that sticks out was when a guy was brought into the ER after being mugged. My mum was supporting his head and neck while he was being moved, and when she let go, her gloved hands were apparently covered in his blood and parts of his brain. Apparently the mugger had hit him so hard in the back of the head with a brick that his head had literally broken. She told me about it when she got home from her shift. I've never seen her look so traumatized. Another incident. The hospital where she works also treats inmates from the prison nearby. When they come into hospital, they're obviously handcuffed to the gurney, resulting in them being convinced that they're either being killed by lethal injection, despite the fact that the UK doesn't have the death penalty, or are being prepared to be experimented on by the government. Once, for some stupid reason, a prisoner was in a room with only a trainee, operating department practitioner, who was keeping an eye on them. Said prisoner was heavily sedated, but he started to come to, then freaked out and ripped out his IV, resulting in blood being sprayed all over the room. The trainee panicked, ran around the room screaming, and my mom and two others ran into the room to restrain the prisoner and throw the hysterical trainee out, all while slipping on the blood that covered the floor. When my mom told me about the prisoner, I was nearly laughing at the comedy skit-esque setting. She said that she'd never been so close to slapping a trainee before and telling them to sort their shit out. My boyfriend and I went camping a couple of summers ago, and I gashed my knee while swimming in a river. It hurt and it bled, but we washed it off and wrapped it up and finished off the camping trip. We came back home and I pretty much ignored my injury because it didn't look too bad and it hadn't been bothering me. I didn't bandage it or anything, and over the next few days it flared up again, definitely got infected and swelled up very noticeably. For whatever reason, I still didn't give it attention, and by the end of the week my injured knee was twice the size of my okay knee. The sight of the cut was pushing out cottage cheesy yellow goop every time I bent my leg, and it hurt so bad I ended up just trying an ice pack to my leg for the day. I thought I was pretty badass for having this crazy infection, and I discovered that the cut had gotten so deeply infected that it had not yet healed from the inside, and to my fascination, I could stick my bacteria-riddled index finger into the wound and it would sink in all the way up to my first knuckle. Yes, that first knuckle. The wound would make a pop sound every time the skin opened up and closed when I moved my knee, and it looked like puckered lips drooling out yogurt streaked with blood. I finally decided it was time to see a professional when 1. I caught a peek at my bone one day. 2. My knee decided to lock in place from the swelling. And 3. I developed a wicked fever. Oh, and I also forgot to mention, I was born prematurely, so I have no sense of smell. One day, my mom knocked on the door of my bedroom and insisted that something was up because she could smell my knee from the hallway. Turned out, it was a staph infection, and if I hadn't have treated it a moment sooner, the infection would have spread to my heart, or I would have needed my leg amputated. I don't know what was wrong with me that summer. I definitely have good hygiene, and I know how to take care of myself. A few years back, when I was a medical student, I was doing my primary care rotation when I had to see a morbidly obese lady for a gynecological issue. She said she was having a lot of itching and soreness in her vagina. Even as I set up for a pelvic examination, I could already tell it wasn't going to be good. I could smell a foul odor already, and I hadn't even looked. I was gloving up when I got so nauseated that I was about to get sick. So I excused myself and lied to my attending that I had a problem taking a look because she was so obese and I didn't have much experience with such a challenge. The truth was, I just couldn't stay in the room. It smelled like rotting vagina. A few minutes later, my attending called in order to show me what he has found. I thought for sure it would be an aborted fetus, but I was wrong. I go in with my mask, and there, my attending dangles this cylindrical object covered with bloody debris. It was a tampon. She apparently had difficulty removing it a week ago, and my attending kept saying, "It stinks like a mag." The embarrassed patient was crying, and I felt bad, but I had to step out of the room because I was beginning to regurgitate my saliva and was on the verge of puking. To this day, I can't forget that smell. I think that was my deciding factor as far as not going into OB/GYN. I just don't want to encounter that horrific smell ever again. I was the night watchman at an abandoned mental hospital turned state park for a summer in college. The only creepy thing I remember was one night I was with one of the state park police and we saw flashlights in one of the buildings. Kids constantly broke in, and other people broke in to gut the old buildings of any copper they could find. So as I was saying one night, we saw flashlights moving around, so we went in. The officer pulled her gun and flashlight, and in we went. We could hear footsteps on the floor above us, so we slowly and quietly went upstairs. We checked every room and found nothing, and with there being virtually no places to hide, we found this very strange, until we heard footsteps above us again. This happened for a few floors, until we were on the very top floor below the roof, and we heard footsteps up on the roof, so we went up there. Still nothing. We never found anyone or any indication that anyone had been there. It was friggin' creepy. There was another night that was extra spooky. I was driving along one of the trails through the woods with one of my friends. There are no lights on the trail, only light source was my headlight. About 20 or 30 yards down the road, I saw a big branch down. I slowed down to drive around it, and my friend screams, "Holy shit! That tree branch just looked at me." I jammed my brakes, and we both jumped out, as someone took off into the trees. It was a dude, full camo from head to toe. I am an ERRN. This, so far, is the only death I've experienced from work that I've lost a significant amount of sleep over. 24-year-old male walks, again, walks into the ER with complaints of flu-like symptoms for the past 3 days. He had decided to come in that day because he started to develop a rash throughout his body that he was unfamiliar with. Sadly, the rash was actually the result of a failed battle with bacterial meningitis, causing him to bleed internally and externally. By the time we got him back to the ER, he started crying blood, and the terror in his eyes was palpable. He went downhill fast. His lucidity diminished with his blood pressure, and the last thing he said before succumbing to pulseless VTAC was something about his mother that we could not make out. You could see his consciousness fade from his eyes as we started compressions. The code lasted close to an hour. At first, we could still keep his oxygen levels up with mechanical ventilation, defibrillation, and drugs. But blood was filling in his airways faster than it could be suctioned out. He was bleeding too fast for any medication or fluids to keep his body pressure up. He died, soaked in blood, and nearly unrecognizable, due to his now almost uniformly purple skin and swollen face. We found out later that he was studying neurobiology. He had a devoted girlfriend that was, for all intents and purposes, a fiancé, a large family, and many friends. He was an athlete who lived healthy, had beautiful curly hair, and this made the death tragic in a way that you don't experience when an 80-year-old dies. It made the unanswered pleas to God for help that had been sent echoing around the room by his family all the more bitter. I helped drag and push him into a body bag. I am a medical student, and I have 2 stories that I would like to share. A super obese woman comes to clinic complaining of a foul odor that she's noticed, and yeah, me and the attending noticed it too. A smell somewhere between rancid milk mixed with rotting fish and a disemboweled skunk swimming in garbage. We do the usual workup, take a good history, do a thorough physical, as best we can given she is huge and has folds and folds of fat and skin draped all over her, including a rectal and genital examination, just in case there was some funky growth down there, and run some simple labs. As me and the attending are discussing how we have no clue what's going on, the nurses come out, holding a green, soggy mush in her gloved hand and waves it in front of our faces. I nearly puked right then and there. Turns out, the woman was using pieces of bread to soak up sweat by putting them in between her fat folds. Apparently she forgot about this one piece, which then stayed there to marinate in her juices for weeks, as estimated by the patient. I was sent to see if there were any more hidden pieces. Luckily for me, there wasn't, but having to lift up and search every fat fold was as embarrassing for her as it was disgusting for me. This second story. A guy was drunk and fighting with his girlfriend, and decides to light up some M80s and throw them at her. Well, he waited too long after lighting one, and ends up blowing off his hand. He's brought to the ED completely drunk and having lost a lot of blood. We stabilize him and take him to the OR, while the hand surgeons are cleaning off his stump of a hand. Me and the surgery resident are fixing all his chest wounds, and one of the surgeons say, "Wow, this is a mess. Did anyone at the scene find his thumb? No one knows. We continue examining, cleaning, and situating his wounds, and lo and behold, buried in a deep wound in his upper abdomen is 2/3 of the guy's thumb. If he hadn't have been so fat, his thumb would have likely entered his perineum. I worked IT help desk in a hospital for 3 years, which meant working a late shift 1 week out of every 6. The first time I ever did this, most people went home between 5 to 6, and it was dead quiet by 7. Later in the evening, I started hearing doors and windows open and close in the building's other wing. This went on until I left at 1 a.m. Windows open, then immediately closing. Doors opening at both ends of a long hallway simultaneously. And it just went on and on all night. I commented to my manager the next day that the security guards took an awfully long time to do their rounds of the building and check all the windows were locked. It went on for hours by my watch. He gave me a funny look and told me that there was no security in our building after hours. I'd been the only living soul in there. It's worth noting that the building has originally been a nun's dormitory, and when they moved out, it was converted into a morgue before getting its final makeover and becoming an office block. Same thing happened every time I pulled a late shift. I heard these noises all night, but never saw anything disturbing. So I decided in the end it simply wasn't a problem. However, leaving the building meant turning off all the lights and then walking 30 meters in the dark to the main doors. I hated that part of going home. I did not witness this firsthand, but the most disgusting medical-related story I've heard from a practitioner who has actually lived to tell the tale is the following. As part of my training to be a rape crisis counselor, a doctor came to give me a presentation about STDs and STIs. Somehow, he veered off the main topic and starts telling us about the things he'd seen in his time. A female patient came in complaining of extreme abdominal pains. The patient disclosed that she was a prostitute. The patient further disclosed that in order to continue working while she was on her period, she would put a sponge as close to her cervix as possible to absorb the blood and other menstrual-related discharge. The patient then explained that she had inserted a sponge and was unable to remove it. The doctor figured it would be a rather routine matter of removing a foreign object that had come lodged or stuck, and takes the patient into an exam room to perform an extraction. When the doctor went to remove the sponge, it turns out that the patient had been using a car washing sponge to absorb her menstrual discharge, and that the same sponge had been in her vagina for 3 months. When the doctor finally managed to remove the car sponge, which had turned into a black, semi-solidified mass due to the excess absorption of nastiness, it also released a torrent of fluids that had been marinating in this woman's vagina for 3 months, and the fluids gushed out and nearly covered the entire floor of the exam room. The doctor told us that it was the first time in his 20 years of practice that he actually vomited while performing a medical procedure, and that the stench in the room was so foul and pungent that it filled the entire clinic and made a seasoned nurse who was standing in the hallway vomit. As the doctor was retelling this horrifying life tragedy that he survived, he didn't look a single person in the eye. His eyes were transfixed on some non-existent point near the horizon of his traumatized memory. As a paramedic, I responded to the call of a traffic accident. which I was told was a baby ejected. We prepare for the worst. We arrive in about 8 minutes, and the trooper is on scene trying to clear the area of bystanders and gawkers to preserve the scene. He had covered the baby with a yellow death sheet that troopers carry in their trunk. I lifted the sheet to check vitals and pronounce death, and it was not a baby, but the top half of a 19-year-old girl that was driving a small pickup truck about 50 yards away. She was driving and arguing with her 19-year-old husband, who was the passenger. They were doing about 55 miles an hour on a 2-lane road and met an oncoming truck pulling a double-wide mobile home. She ran under the front corner of the mobile home, cutting her in half. The bottom half remained in the driver's seat, while her unhurt husband watched as the truck skidded another 50 to 60 yards, sidewiping a minivan, sending it into a ditch upside down. When the truck came to rest, her bottom half fell out onto the ground. We also found a trail of ribs from the cab to the bed, and down the pavement to the top half. It looked like a movie set. Her top and bottom half looked unhurt, but from mid-chest to about pelvis was strung along the road. The husband was absolutely freaking out about what he had just seen. He was babbling incoherently, running around swinging at people, and generally just a mess. The witness, who lived right in front of the scene, started having chest pains and had to be transported. We took the husband, and I called medical control and actually got orders to give him IV Valium, something paramedics normally can only give to grand mal seizures. The driver of this big truck was fine, but was also very, very distraught at what he had just witnessed. That was 16 years ago, and I can still remember pulling up to that scene like it was yesterday. I worked as a hospital chaplain this summer. We got called to every code blue in order to be with the family and or pray while the staff worked on the patient. At 3:30 a.m, I get paged to the cardiac ICU. A 30-year-old woman has coded, and they are working hard to get her back. She is flat on her back while they are doing compressions, and she's not conscious. No family present, so I am working hard to stay out of the way and pray silently. When all of a sudden, this woman sits up straight in bed and full-on screams, "Let me go!" Everyone just stops and stares at her. Finally, after a pause that felt like forever, someone says, "Not today," and everyone kind of starts chuckling and breaks what felt like a very tense room. The staff quickly go back to work, trying to stabilize her, much of which she actually refused for the first minute or so. After she was stabilized a little more, I returned to the call room and continued with my night. But months later, thinking about her and that scream, I still wonder what she may have seen and why she wanted to go so badly. Her scream has been imprinted on my heart and still gives me chills. There is this abandoned mental hospital in my town called Prudhoe Hospital, near Newcastle in the United Kingdom, which is sort of the scary place kids go to show bravado. It's surrounded by woods, so obviously you hear a lot about it. You hear lots of stories from people after it was abandoned, but the spookiest things come from when it was still in service. My mum worked as an auxiliary nurse there for years, and she said at night, the crippled kids who couldn't move due to severe disease and birth defects would somehow get out of their cribs and into the middle of the floor on the wards. Whatever was doing this would also go around and remove blankets from all the patients and again pile them in the center of the room. Eventually security was hired, believing it was someone getting into the hospital at night and doing these things to scare people or just to cause trouble. However, even with security, they never found out who was doing these things late at night. This is only one of the hundreds of stories I've heard. It's quite spooky, and seems like whoever you talk to has a different story. In the 90s, I worked overnight and weekend security at a center for psychiatry that cared for inpatients, outpatients, and even the criminally insane awaiting trial. That area of the building was basically a prison instead of a hospital. People would often bring in the arrested for evaluation, and the homeless could even walk in and ask for help. We saw all kinds. I did this job for years, and some nights got very, very busy. Two scary situations really stick out from those times. The first, I was manning the front desk, and a walking patient holding a knife walks in, screaming that he wants to kill himself. He had cut himself all over his body and was covered in blood. My supervisor quickly rifled through the database and found him. He had a history of violence against staff, AIDS, hepatitis, and more. I was commanded to put him down, and I approached him with a chair as a shield. When he wound up to swing the knife at me, I rammed him with the chair until he went down. Then a bunch of staff jumped in and everybody put 1 foot down on him until he was better subdued and eventually sedated. A doctor was in my face right after, yelling, "Did he touch you? Did he cut you?" I still wasn't sure until after an examination. The second incident started when 2 police brought in a tough-looking guy for an assessment. This guy is keeping his head down, not saying anything, and I led them into a secure observation room. The arrested and 1 officer goes in. The other cop returns with me to get our information and to see if he's in our database. Suddenly my partner, who was watching the monitors, jumps up and hits the alarm and run back the way we came in. We run after, and the door is wide open, and we see the guy wailing on the officer with his handcuffs like a one-handed flail. The other cop does most of the work in this case, and the arrest is pretty much laid out on the floor. How did this happen? How did this happen? In my quick inspection, I notice that his hands are funny. They're all covered in blood from the fight, but something doesn't look right. I look closer. The guy doesn't have a thumb. Even the ball socket that attaches the thumb to the palm has been removed. The cop looks at the other hand. Holy shit, both thumbs removed. They cuffed the guy and didn't notice he was missing both thumbs. The cuffs would just slide off. Still thinking about that guy. How? Why? For what reason? What crazy world was he a part of where something like that could even happen? I still wonder. I participated in an experimental program in the 80s through a hospital in Memphis that was supervised by a governmental agency. Patients were supposed to be supplied medicine, medically supervised by doctors and nurses that were employed at the hospital, and therefore not biased to the outcomes of the study. It was a double-blind study. Several of us had adverse reactions to the medication: tremors, seizures, insomnia, night sweats, and both auditory and visual hallucinations. One lady slipped into a coma and was quickly removed from the program. I found out much later from one of the nurses that she died after a severe seizure, and it was covered up. They split us up, the patients with adverse reactions, so we would not be able to compare notes. We were also not allowed visitations, and phone calls were strictly monitored, with there being no permission of outside mails or parcels to be delivered. I first experienced mood changes, then sleepwalking, and I became combative when awakened, violent. I'm normally as meek as a mouse, and I then experienced sleep paralysis. The staff viewed this happening, but did not help me, deciding instead I was being a difficult patient, but I was locked in my body and could barely breathe. This black shadow was sitting on my chest, crushing me, stealing my breath, and a nurse plunged a needle into my arm. I knew I was dead. I just knew I was dead, that would be the end. But instead I fell into a merciful sleep, during which I was sent to a mental institution. My admitting psychiatric doctor was told I was brought in from a different hospital via ambulance in a 5-point restraint and had to be heavily sedated, and I was labelled as dangerously violent and a psychotic patient. They diagnosed me with schizophrenia, moderate to severe, and manic depression with severe mood swings. I was informed, because of my delusions, this so-called experiment never took place, and because of my actions, that I was putting myself and society in danger. And I was a patient in there for 3 years of my life. I was never paid for participating in the experimental program as promised, since it didn't exist, and I never found out the name of the medication that to this day still causes me dizziness, blackouts, and sleepwalking, and occasional insomnia. Sometimes nervous tremors, but eventually the seizures stopped. I still have sleep paralysis. 4 times it has occurred, but that's a horror story I must tell on some bright sunny day. To speak of it on a dark night such as tonight, when all the lights could go out, is unthinkable. I couldn't sue the program since it was apparently a delusion. But note this, my 3-year stay was paid for by Medicaid. I never even applied for Medicaid. Obviously someone had done it on my behalf, for reasons which I think we can all suss out. I have searched for other members of the experimental program, to no avail. I thought I recognized one person, a male, several years ago, but he became very agitated and wouldn't speak to me, even jerking his arm from my grasp and hurrying away. The nurse is the only person I ever encountered again that would speak to me, and she was obviously very uncomfortable. I only saw her that once, but that confirmed to me that this did take place, and that it wasn't in my head. I know I will never be compensated, but I still want answers. Why did I have to be institutionalized for 3 years of my life? What was this medicine or drug they kept feeding me? What was the purpose of the experiment? If anyone involved in the program is hearing this, it was in Memphis in the late 80s, and you're more than willing to help me find answers. Please let me know. I want to get in contact with you. But be careful. I feel like I'm taking a risk even discussing this. This pseudo-patient experiment mentioned in a conspiracy theory video brought everything flooding back to me. I can't help but wonder how many other cover-ups like this have happened that have just been swept under the rug. I was doing a 2-month internship at a very famous forensic hospital in Germany prior to my studies. Many patients there are thought too dangerous to ever be released, which effectively means even if they're due to be released, they stay in the hospital. The hospital I worked in was separated in 2 sectors. The first was for acute psychotic patients. There you had the screaming, schizophrenic, and acute dangerous people. For example, when you got stuck on an acid trip and killed someone, you came there. Some of the patients there were relocated relatively fast to normal psychiatric hospitals. The second one was mostly for patients who were already locked in for several years. They appeared not as obviously insane as the others, mostly because their medication was adjusted really well during the time. That's the place I worked in. We had a lot of paedophiles in there, but they were more pitiful, to be honest, and not really dangerous or creeps. They got medication which suppressed their libidos, and as a side effect, they were really sluggish and appeared to be kind of dumb. But there was one patient who really terrified me. In contrast to most of the others, he was really intelligent, cultivated, attractive, and extremely charming. He was some kind of accountant before he got into the psychiatric hospital. Apparently he had a competitor at work, who he killed, partially skinned, and then decided to place the corpse in the office to show the others what happened when you got in his way. After 10 years doing forensic psychiatry, he tortured his roommate to death at night over some minor argument. This dude really terrified me. I'd never met such a cold, manipulative character like him. He had this special, super creepy look on his face when he was alone with you. Like he knew all your secrets and weaknesses. There was another really uneasy situation when I nearly shat my pants. Of course, it was during the night shift. Of course, our office was separated from the part of the building where the patients lived, and the only way out of the patients' area was through our office, which was highly secured with automatic locks and cameras. Two of my colleagues made their rounds to look after the patients. I stayed in the office and watched the surveillance cameras, and suddenly I got an unsettling feeling. I looked out of the window, and in the reflection I saw a young woman hiding behind the door, watching me, smiling. I instantly jumped up out of my chair and pressed the alarm button on my pager. Even though the woman was one of the chilled patients, after we brought her back into her room, we tried to reconstruct how she might have got out. But on the cameras, we saw nothing that could have explained it. Unfortunately, it was during one of my last days there, so I never did find out what exactly happened there, but it was super creepy. I am a nursing student due to graduate in May, who just wrapped up a 10-week internship at a nearby level 1 trauma center. Most of my summer was kind of run-of-the-mill stuff. Gunshot wound, stab wounds, stage 4 pressure ulcers on long-term paralyzed men. And my last day, however, I encountered the new admittant, who staff referred to as the swamp monster. He had been found a couple of days earlier, when he walked out of the marsh into a couple's backyard, asking to use the phone since he'd been shot by a state trooper. While the surgeon who admits him believes he was actually impaled, not shot, his wounds were still gnarly. Whatever had impaled him nicked his left ventricle, so in addition to the wound from his initial injury, he also had staples in his chest, and by 20 hours past his admission, all his wound sites had become neurotic. You could smell this from the nurse's station. He got a besides abdominal X-lamp down, since he was 20 liters positive and developing abdominal compartment syndrome. The second they cut through the last layer of fat of his abdomen, his bowels flopped out, along with some excess fluid. They also cannulated him from ECMO at besides the well, involving putting 2 giant catheters into major vessels to redirect blood away from the heart and lungs to get oxygenated in a machine. Opening his chest was an interesting experience though, and he was more neurotic than we thought, and that smell was heinous. I could smell it through my surgical mask. Glad to say, he made it. I am a surgical resident in plastics. My caseload usually doesn't fall under a grotesque category, but I've had a few admits from the ER that make me question my humanity. 2 weeks ago, I got a page from the ED and went down to find a middle-aged man who had 90% of his body burned. His skin was essentially gone. I don't think anyone could even understand his pain levels. This man was in mortal agony. As I assessed the patient, the ER attending told me that this guy was homeless, and apparently he had been taken to the ER a few times before this year, and was known by those who treated him to suffer from paranoid schizophrenia. And he was assaulted by several teenage boys. One of them decided to set him on fire, and probably would have finished him off even further had it not been for a local store owner who tried to chase them down and was the one who called 911. A year before, I was part of a treatment team for a 5-year-old girl whose father beat her so savagely that her face looked like it had been caved in or mauled by some animal. We don't have a burn unit at my hospital, despite the fact it's a major trauma center. So as soon as we get the burn victims stabilized, they are transferred to another facility. I don't know what happened to the man, and I never saw the little girl again once she was discharged. I never found out whether those boys were caught or not, and I've been praying ever since that the bastards will be found. I was a surgery nurse for 5 years. I have several stories that people love to have me tell. Here's what I think is the grossest one. I had a roughly 65-year-old woman who had just had a fempop bypass surgery. So she had a femoral artery incision in her groin. This is a fairly common procedure to care for on my floor, so I've become accustomed to my CNAs knowing what the aftercare should be, which is lay flat for an hour, no straining, pressure, dressing on the incision, etc. But this day, we had a float from another floor who didn't know. After doing my incision checks and assessment, the aide came to help clean the patient up, as she had sweated a ton in recovery. During the bed bath, the aide apparently removed what looked to be an extra bit of tape, but was actually helping to hold the pressure dressing in place. If that had been it, we may have been okay. But then the patient told the aide that she hadn't had a bowel movement in several days, so the aide put her on a bedpan to try. Several minutes later, the patient's roommate hits her call button because my patient was making a weird whimpering noise. I go in to find my patient white as a ghost and only semi-conscious. I immediately yell for help and pulled the sheets back to check her incision, only to find blood all over the bed and her groin. The aide comes in to take her off the bedpan and freaks out. As I'm holding pressure on her incision, as an attempt to stop the bleeding, the aide pulls the bedpan out, and floating in a pool of rapidly clotting blood is a nice big turd. I rode her bed all the way to the OR holding pressure. She had to have emergency surgery and 6 units of blood, but happily she made it. And I definitely learnt the importance of talking to your CNAs. I am a psychology student. This is a story from one of my most favourite abnormal psych professors. My professor was working with a patient, doing some job counselling. We will call the patient Julie. Julie is a 23-year-old woman who lives with her mother, stepfather, and her 5 children. She is having trouble keeping a job, and she has recently been fired from her job at a call center for falling asleep on the job and for lashing out and assaulting her manager. She has been fired from 8 out of 12 jobs, and she is studying to become a CNA and has had multiple warnings for falling asleep in class. 4 out of her 5 children are in the custody of her mother due to a personal and family history of drug abuse, drug trafficking, and check fraud. Julie has her own probation officer, and 2 of her children have probation officers for fighting at school, as one almost killed another kid by strangling him. There is constant fighting in the home between Julie and her mother, but they do not argue when the stepfather is around. Julie's mother denies any sexual abuse occurred when Julie was a child, but Julie remembers otherwise. It came out later in therapy that Julie was never taught how to tell the time. The reason she was so tired was because she was staying up all night watching television, so that the correct television time slot would prompt her to wake her kids up for school and for her to go to work. In addition, my professor found out later that all 5 of Julie's children were born from an incestuous relationship with her own stepfather, who had been sexually abusing her since she was a small girl. She was also staying up all night to protect her children from her stepfather. But, as a good twist, Julie got the right diagnosis for borderline personality disorder. She continued therapy in school and got back custody of all 5 of her children. She is now happily married to a woman and is an artist. So, no, it's not the scariest story, but I'll never forget it. We had several other cases to analyze during the class, but this one about Julie will stay with me forever. I can't get over the fact that no one ever taught her how to tell the time. Hey guys, it's Mort here, and thank you so much for listening. I hope you enjoyed the video, as it was the topic voted for by you. I had a thought. Would you guys like me to do more of these votes? I want to try and get into a routine of doing them every 3 days or so, to give you guys a bit more control over the content that you would like to see. Of course, the options that didn't win will of course feature, but probably not on that day. So no worries there. Let me know in the comments section what you think. I would really love to hear your feedback and your opinions on this. Do you like being able to vote, or do you like it just coming randomly every day? Let me know what you think. I'd love to hear back from you. If you did enjoy the video, something that would really help me would be if you dropped a little like down there, as well as a little comment. You know that makes a big difference to push that YouTube algorithm. And why not hit the subscribe button and the bell icon to be notified of every time I upload. I do upload every single day to keep those spooks coming every night. So be aware. If you've got a story that you would like me to read on the channel, all that you need to do is send it my way via email or Reddit. Bear in mind though that you need to add a lot of description and punctuation and paragraphing, as those are key factors that will get me to read your story on the channel. But anyway, for now guys, I'm gonna sign off. Stay awesome, and I'll see you in the next one.